Hello, good evening. Today we will discuss about the effects of alcohol. Here we will discuss about the male fertility, female fertility, and how is sperm quality affected by the alcohol. So let's begin. Those persons who are trying to conceive are affected by their infertility, and almost 15% cases are of male infertility. The influence of alcohol consumption on the quality of semen has a dose effect on time effect relationship. It affects the sperm volume, vitality, and survival rate negatively. It's not just the ladies who need to check their alcohol consumption if they are planning for a fetal anytime soon. Even the men needed to be careful about their booze dose. This is the fact that alcohol causes infertility in men. There might be problems in erection, issues with testosterone production, difficulties related to healthy sperm production. Excessive alcohol lowers testosterone levels and sperm quality and quantity in men. It also reduces libido and causes impotence. If a man drinks heavily, it can really reduce a couple's chance of conceiving. So the next is effects of male and female infertility. The first is male infertility. Hormones are very crucial to male reproductive health and are produced in both the hypothalamus and the anterior pituitary gland. Together, the hypothalamus and the anterior pituitary gland may make common hormones in the body. Two of the hormones that are made from the pituitary hypothalamus working with the anterior pituitary gland are: the first is the luteinizing hormone and the other one is follicle stimulating hormone. These hormones travel through the body and impact the testes, and they also play an important role in sperm production. Alcohol use indirectly impairs sperm production. They harm both the hypothalamus and anterior pituitary gland. Heavy alcohol use can reduce the amount of luteinizing hormone that is made and can even cause any LH, that is luteinizing hormone, that is made to be less potent than normal. Alcohol is also believed that reduces the amount of FSH that is made. It directly impacts the testes. Heavy alcohol use can cause problems with the making of testosterone, एंड बेसिकली ये टेस्टोस्टेरोन प्रोडक्शन को हर्ट करता है, जिसमें कि हमें लेडिक सेल्स जो प्रोड्यूस करती हैं उनको हार्म होता है और ये टेस्टोस्टेरोन लेवल्स को डिस्टर्ब करते हैं. Testosterone has many roles and one of them is to help to make which helps in making the sperms. The testes have a major role in the male reproductive system जो कि प्रोड्यूस करते हैं टेस्टोस्टेरोन और स्पर्म्स दोनों. तो जो ल्यूटिनाइजिंग हार्मोन होता है वो सिग्नल देता है टेस्टिस को टेस्टोस्टेरोन्स बनाने के लिए. Alcohol though can cause problems with this process. Both short-term and long-term heavy alcohol use has been reduced the testosterone levels. It stimulates estrogen production. That is, many studies also show that heavy alcohol use can even turn testosterone precursor chemicals into estrogen. This effect leads to increased estrogen levels in men. It shrinks the testes. Alcohol does this by causing loss of sperm cells and harming the seminiferous tubules where sperm is formed and the Sertoli cells where sperm grows. It leads to impotence and other health problems. Combining drugs like marijuana or opioids with alcohol also lowers fertility. In addition, the liver disease caused by excessive drinking can change sperm quality. The next is female infertility. Drinking alcohol, smoking, or taking drugs during pregnancy or while breastfeeding can affect your child's health. Women who are pregnant, who are trying to conceive or breastfeeding should avoid smoking, drinking alcohol, or taking illegal drugs. Always speak with your doctor or midwife before taking any medications, as alcohol can lower the chances of becoming pregnant. It causes female infertility and fetal alcohol syndrome. What fetal alcohol syndrome is, I will explain you. So the current medical guidelines also have said that if woman is pregnant or planning a pregnancy, the safest approach is not to drink alcohol at all to keep risks to your baby to a minimum. Drinking in pregnancy can lead to a long-term harm to the baby, and the more you drink, the greater the risks are. If a woman is trying to get pregnant, she need to be aware that drinking alcohol can reduce her fertility and ability to conceive. Drinking too much, especially getting drunk, can lead to a miscarriage in the early stage of pregnancy. When a pregnant woman drinks alcohol, the alcohol passes through the placenta and can affect the baby's development. This happens throughout the pregnancy, not just in the first few weeks. Drinking too much can lead to premature birth, low birth weight, impacting on the physical and mental development of the child, a condition which is known as fetal alcohol syndrome. Fetal alcohol syndrome (FAS) women are therefore strongly advised to not to drink alcohol at all at any stage during pregnancy because there may be an increased risk of miscarriage. The current advice is to avoid alcohol completely. Alcohol and breastfeeding. As alcohol passes to the baby in small amounts in breast milk, the milk will smell different to the baby and may affect their feeding, sleeping, or digestion. The best advice is to avoid drinking shortly before a baby's feed. So, the next is fetal alcohol syndrome, also known as FAS. Children who are born with FAS can have growth problems, facial defects, and lifelong learning and behavior problems also. Fetal alcohol spectrum disorder (FASD) describes the range of less obvious effects that can be mild to severe and related to one or more of the following symptoms of FASD. F it is FASD. FAS is fetal alcohol, and here S is for syndrome, and in this S is for spectrum, and D is for disorder. So, one or more of the following symptoms of the FASD are low birth size, problems eating and sleeping, problems seeing and hearing, difficulty following directions and learning to do simple things, trouble paying attention and learning in school, trouble getting along with others and controlling their behavior. Children with FASD may need medical care all their lives or may need special educational support. FAS and FASD are completely preventable by not drinking alcohol during pregnancy. It female infertility which affects the oocytes also. In this picture you can see this is an oocytes in which you can see the vacuoles also. It's not 100% or it's not 50% also that it can fertilize. So there is a problem in drinking the alcohol. It causes the female infertility. Next is how sperm quality affected by alcohol. You might be wondering about the effect of alcohol on sperm count. Alcohol use affects sperm quality in several ways. The first one is alcohol is believed to directly harm the Sertoli cells of the testes where sperm grows. This effect is even true of male fetus before they are born. A study found that even after becoming adults, sperm and semen were abnormal in men whose mother drank alcohol while pregnant. The second is alcohol can harm sperm motility. It, it is said that abnormal sperm is more common in men who drink more than 3.5 servings of alcohol per day. Low sperm count, shape, and movement have also been found in men who struggle with alcohol use, meaning that there is a negative effect of alcohol on sperm motility. Sometimes men have a complete lack of sperm found in the semen, and researchers also believe that this is also due to alcohol use. In one study of men who struggle with alcohol use, only only 12% had normal semen. Among men in that study who had very heavy alcohol use, none had a normal semen. So, the more alcohol a man drinks in one day, the more likely the man is to have abnormal sperms. Stop heavy alcohol use can improve male fertility. And another study has shown a clear improvement in semen within 90 days after stopping alcohol. So please guys, अगर ये समझ आया है तो बस जो भी अल्कोहल पीता है वो छोड़ दे. Thank you.